Does anyone want a makeshift napkin?
So let's do the salute to the flag. We'll stand.
Oh, here it is. We know that.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We need to adopt the agenda and approve the consent calendar. If I could get a motion on that.
I move to accept the consent calendar.
I'll second. Okay, and, so, Desmond's got that now. Okay, and we also have the approval of the agenda, or the adoption of the agenda.
I move to so do.
I'll second. All right. Okay, yeah, all in favor of adopting the agenda and approving the consent calendar?
Yeah.
Any opposed? Okay. Let's see, we got the next thing on the consent calendar is you can read to approve the minutes.
We did that in the consent.
Oh, we did, okay. I knew it was. Okay, we need a, I'm supposed to give a report. I don't know, I don't have anything to report at this point, so.
Okay, someone's got a bird.
I think she's in Hawaii.
Yeah, Joan, I think you have a bird. Can you mute yourself or I can do it, I suppose? Wow. Okay.
Okay, let's see. Sure. Okay, I have no report. Do we have any? Well. We're having a public hearing. First
Oh, wait.
item on the agenda.
You missed the chairperson and commissioner reports.
This is an opportunity for the board and city appointed commissioners to provide short informational updates on matters of
Okay.
commission concern.
Sure. Does anybody have a report?
I guess I do.
Okay.
I wasn't really prepared, but it's kind of we're experiencing another, the left hand doesn't know what the right hand's doing situation in our senior center. Someone has authorized the installation of one of these conferencing units. And excuse me, we understood it was going to go into our large conference room, which I believe is bigger than this. And they put it in an egg. We showed up and it's in the small conference room. I was thinking it would have been nice to have been able to have these meetings at our senior center instead of here in this cramped quarters. When things like that happen, we don't even know who authorized it. We're not getting the information. We could have solved this problem before it happened by putting it in the large conference room if somebody had discussed it with us. And we need to find a system where we can work together instead of everybody doing their own little thing.
I can actually speak to that installation because it was an installation we authorized. We put it in that room. We're not able to hold commission on aging meetings at the senior center. It's not been authorized by our board of supervisors as a meeting space, so that's not available to us. But that video conferencing system we set up in a smaller space for our staff, our area agency on aging staff, to use it for staff trainings, meeting with clients, to improve our services. So that is a county installation intentionally in the smaller conference room for our use.
So the county can't share its facilities with amongst ourselves, you mean?
I don't understand that.
I mean, well, they got a system there, but they're not willing to share it with other uses.
This is funding that was specifically for this purpose. So it is for county staff. We're improving our required training of our senior nutrition staff at that site.
I don't have a problem with that. I just don't understand why they can't set it up so everybody can share.
Not for public use.
No, I mean for like this meeting, you know, other meetings,
Thank you.
Public comment later.
Um,
May I come?
sure.
All our meetings, they have to be approved by the Board of Supervisors,
They do, okay.
and that one is not.
Okay, well, I appreciate the clarification because it's caused a lot of confusion, that's all. Thank you.
I'm glad you had that information. Okay, I'm gonna give the chairperson a report, and that is basically the fact that I've never dared using before. So. And I probably will.
Okay, and I have a report too. I'd like to welcome our newest member.
Yes, oh yeah.
This is her first meeting with us, and she was elected by the Board of Supervisors last Tuesday, so she's 2 days new. And so welcome and.
Yeah, this is my third day.
Yeah, well,
I'm Julie Bauer.
and thank you for joining us, and we look forward to working with you.
Thank you. Same here.
Want to tell us a little bit about yourself, brief
Briefs,
or not?
let's see, I'm from Placerville. My parents and grandparents are all from Placerville. And my interest in being on the Commission on Aging has to do with, my taking care of parents and grandparents for many years. Most recently, I took care of my dad for 5 years, and I learned a lot. And I learned that there's a need for, information, whereas aging is a concern, advocacy for older people, resources, and I had to learn the hard way where they are and how to access them and what's available and what's not, and what's income-based and what's not. It's just, there's a lot out there, so I feel after taking care of my grandmother who had Alzheimer's and my dad who had 5 years of struggles and seizures and whatnot, that I have a real interest and a lot of knowledge in this area, so I thought this would be a good way to, sort of share my information and my passion for this community, so.
Welcome to
I'm glad to be here.
welcome to the Commission on Aging.
Thank you.
Julie.
All right, Joan's got her hand up, so,
Okay.
Joan, you can unmute yourself.
Done. Hello, everybody. I am watching in from beautiful Hawaii. Aloha. And I just wanted to add my Julie. I'm not there now, but I wanted to add my welcome. And I'll be watching from afar, and y'all have a good meeting. I will miss being there, but I'm here. Okay.
Thank you.
Yeah, I'm sure you're missing it.
Okay, are there any other reports from commissioners? Okay, we'll move on to the public hearing. Area on agency, aging plan, aging area plan. Who is it to do that? Yvette?
I will.
Okay, Yvette, would you go ahead and do it?
This is a scheduled public hearing, so we are opening public hearing for the presentation on the annual area plan update. Last year on May 16th, we held a public hearing in front of all of you for the 2024 to 2028 AAA area plan, and AAA is the Area Agency on Aging. for Planning and Service Area 29, so it encompasses all of El Dorado County. The document acts as our planning and budgeting guidance for AAA older adult services and initiatives for programs that are funded by the Older Americans Act and Older Californians Act. We are required as part of this process to update our area plan annually, and with that, we will take a look at the demographics, we'll take a look at a progress towards the goals that were identified in that initial plan. The AAA is required to hold at least one public hearing during each year of the 4-year planning cycle, which is what we're here to do in front of you today. And the purpose of this is really to solicit comments from the community on the area plan and review the demographics and steps towards completing our objective. One of the things that CDA does as we're starting this process is they do provide us with our demographic data. Yasmin is going to pull that up shortly, so we have something to discuss with all of you.
It's on the one sheet that they all have right on.
Oh, it's in front of you, on that sheet. So this shows how our demographics in El Dorado County have changed since 2022. So you can see the fluctuations year by year on that. And it's important to know that you can see that the percentage of low income seniors has increased by 8.88% over the last 4 years. The percentage of Medi-Cal eligible seniors has increased significantly by 22.41%. Did you all receive that?
Was the copies, where did they end
They're
up?
being passed around.
Oh, this one, there's 2 different sets.
Yeah, so at the bottom of the page, you'll see the schedule of demographics that we're reviewing for our changes. And this helps guide where we're taking our goals. If we determine that we need to change our objectives or implement new objectives to help us meet the goals of serving our populations.
Everyone should have 2 documents. One has is section 7 with the goals and objectives. And the other one is the executive summary with the green chart on the front. Does everyone have those? Okay.
How about the first one you mentioned, not with the chart of demographics on it, section 7 is the first page, is
I
everything
didn't know if this is the right place to say it, but I tried downloading this yesterday. I was anything downloaded from county website.
Yeah, I don't know. I haven't heard that from anyone else, so.
Okay, I just check.
Okay.
That is your, what was your, that, is your presentation finished?
No, I still have more. Waiting for everyone to catch up with the documentation, and Yasmin's gonna pull up the screen shortly.
Julie, by the way,
Or just a note.
Oh, I never noted myself. How'd you get to?
I think it's called me too.
All right, can everyone see that, or do I?
Singing.
Oh, is the bird singing again? Yeah, I will. Joan, can you mute yourself?
Well,
Your bird.
Am I unmuted?
She is honey.
Yeah.
There you go, so.
Okay.
She got it.
Okay.
Can everybody see that or should I make it bigger?
Make it bigger.
Is that, yeah, that's too
Oh, that's
big.
big.
That's too big.
Too big.
Can't be too big.
Yeah.
Yeah, I can see
I was just kind of like,
Oh, then you just-
There we go. We got it.
Is this there?
Can everyone read this?
Yes.
Okay.
All right,
Perfect.
so I'll kind of start this over again, so we're all on the same page. So this shows the demographic information that's important to the population we serve that is over the age of 60. You'll see the various categories that cover low income, Medi-Cal eligible, geographic isolation, those are on social security, SSI, SSP, those who live alone, and those are non-English speaking. So you can see we've had some significant changes in some of these areas. When you look at the low income category for seniors that are age 60 plus, you can see that we experienced an increase of 8.88% since 2022. Those seniors who are considered to be in geographic isolation in the rural parts of our community, you can see that took a big jump. That's been, that jumped up to 53.46% of an increase, which is pretty substantial for this time frame. You can see the seniors that live alone. We're looking at an increase of 16.57%. One of the areas that we're also looking at with this information recorded, we don't have any data on what the actual difference is, but it says non-English speaking seniors. That number has experienced a substantial decrease from what was reported in 2022. So that's down by 68.04%. So this is just something that we use to set targets for who we're serving in our community and what our services look like, how we might need to change our outreach, or if we need to consider programs that will target some of these populations that we see increases in. So that's one of the reasons we review this on an annual basis. One of the other things that we use this annual update to do is show that our progress that has occurred on an annual basis. So the progress that you'll see in the documents in front of you cover the 2024-25 period, which we are getting ready to wrap up. We have 5 primary goal sections that we look at, which include outreach. And I'm not following along in a written report with you, but these don't have page numbers to help. But you'll see when we start this section right here, this is where we outline our goals and objectives. So the area that's in black writing is what we reviewed last year as the goals that we were setting for our area agency on aging.
Your second document.
And it's broken out into 5 categories, which include outreach, engaging the changing senior and the availability and increasing access of aging services, emergency preparedness, volunteering, civic engagement and community collaboration, and education and training. You'll see in the green narratives on this report, this is the current year's annual update. As we go through the next couple of years, you'll see similar narratives, but it'll be populated in here in a different color to show the progress that has been made on an annual basis. So you'll see this document growing over time and then narratives changing. You'll see some of these goals we haven't made progress on. Some reasons might be staffing matters. We had started making progress on a senior volunteer development position. in Placerville. We had staffed that position, and the candidate that we had moved into that quickly took another position in HHSA. So they moved out of the program. So right now we're looking at bringing staffing back in to that. So we made progress over the year, but then we had a bit of a setback with that goal. Some of the other notable work that we've done is we've been promoting information and assistant office hours in South Lake Tahoe. We're really taking a focus in this area. So we have quite a few things to update you on today on progress that we're making with really making improvements to the services we're providing in South Lake Tahoe. You can see that the outreach events by the Commission on Aging, the commissioners have attended 21 events so far this fiscal year, which is pretty substantial. And we couldn't do a lot of the work we do without the support of the Commission on Aging. The Commission on Aging is also, we have 2 members that participate in the California State Legislature. So they're able to come back and give us updates on things that are happening at a state level that impact the senior population that we serve. This document discusses the annual monitorings that are completed by the Commission on Aging of our area Agency on Aging program. So these are all programs funded through the Older Americans Act. Our long-term care ombudsman onboarded 3 new volunteers, and I think over the last couple of years, we've had a lot of conversations on how COVID impacted some of our volunteer base and the efforts and staffing and the efforts we've been taking to try and build back up. And the ombudsman program is one of those areas that were very heavily impacted by the loss of volunteers during this time frame. So being able to onboard 3 new volunteers over the last year is quite significant because they have major training and certification requirements, and they are going out every month and visiting every skilled nursing facility and residential care for the elderly that are in Dorado County. So they are out in the community visiting all the sites and advocating for residents of those facilities and ensuring they're treated fairly and that their rights are being respected. Let's see, we've also increased the use of Facebook to market our events and services. Jordan has been doing a really great job. You'll see on a lot of the marketing materials that go out, she has put codes on there so you can take your smartphone, scan the image on it, and it takes you directly to a site that can give you more information about our programs and services. So really trying to determine new ways to improve outreach and keep our seniors engaged in our programs. And there's so many updates in here. I can't go through all of them, but I will give you a chance to ask questions if there's something you're looking for specific information on. With these updates, we are looking for input from the community and from the commissioners on information that we might be able to add or anything that you would like to see happening in these areas. We will review the comments that come back to Yasmin for incorporation in the final revision. And then once we have internal reviews and approvals, we will bring the area plan update to our governing board, which is the County Board of Supervisors. And once they approve, we will submit this to the California Department of Aging. And this is a requirement on an annual basis for us. So at this time, I can open for input. And we will take notes.
Do you have a breakdown of east slope versus west slope on all these demographics? And are we breaking down the budget for Department of Aging based upon the population for east slope versus west slope? Or is all the money being dropped off in Placerville and South Lake Tahoe gets just a little bit?
We operate out of multiple sites. We are a county service. We provide services all across the county. We operate at 7 different sites. So we're in Georgetown, we're in El Dorado Hills, we're in Cameron Park, we're in Placerville, Pollock Pines, South Lake Tahoe, and at the Placerville Senior Center. We provide the same senior nutrition services at all the sites. Our senior legal comes up, they're funded entirely in Placerville, but they come up once or twice a month to serve the public. In the South Lake Tahoe Senior Center, information and assistant comes up regularly. We've held bingo size classes. So the funding that we get is not allocated by each area we serve. It's allocated to the staff that are serving the areas within the community. We are lucky that South Lake Tahoe is the one site that does have its own team up here, but a lot of our resources are spread across the county, not specific to any area.
But how is the funding for the senior services broken down? Is it based upon demographics in each of those locations? Or is there a bigger supply of funding down in the Placerville, El Dorado Hills area?
I don't think we have the breakdown specific to site that you're asking for.
Do you have a breakdown of the demographics of which towns have what kind of populations of seniors?
Not as part of the area plan, but we do have data that's available that can be pulled together, but that's not what we're looking at in the area plan. The area plan covers all of El Dorado County.
Yeah, any other comments?
Behind you. Hi, I'm Trudy Morgan with Senior Inc. and I have 3 questions.
Okay.
The first thing is in regards to the TV that was put into what we call the veterans room. The reason, we don't really care that it's there. The problem that we have with that is we have games that are going on in that room. And so we need to know, or you need to know what those days are, not to schedule that room, because there was, I guess, a little confrontation and we were basically told to get out. And we said, go into the main room, which is where they did go. But I think that somehow we need to be able to coordinate the use of rooms when you need them and when we have things booked.
I can't speak to a confrontation. The confrontation hasn't been brought to my awareness, but we will investigate what you're sharing with me right now. But it's my understanding we schedule all these rooms. These rooms shouldn't be used without having it on the schedule. So there should be coordination of that. And maybe they came on site as part of the installation in that room, but we are aware that we're all sharing the whole facility. So if something happened.
We weren't aware, Jamie. I think we talked to you and you didn't know who put it in or what was going on.
Well, no, I knew, I knew it was the county, but I just didn't know in the rooms. But I didn't know that you guys, there was somebody in there when you tried to play games.
Yeah.
This
they were
conversation
playing
right
games.
now is about the area plan.
Yeah.
This is public comment for the public hearing on the area plan, so we can also discuss that later.
And there's a section at the end of the agenda that's open public forum. Everybody has 3 minutes to speak, and that will be the proper time to ask
Okay.
those questions.
Do I need to discuss that again or just say we've done it now?
Your message is heard,
Okay.
but that
Okay, I'll discuss the
room
3 items at
reservation
the end.
isn't, yeah.
Okay, thank you.
You have 2 other questions?
I do, but they said to wait till public.
Oh, so it's not about the area plan?
No.
Okay.
So my name's Eric Asbury. I'm a citizen in the city of South Lake Tahoe. And I just, I don't know if this fits in with the area plan, but there is a multi-million-dollar recreation center that's being developed here, for those that aren't aware, in the city of South Lake Tahoe. And then so there's been talks about the old rec center costing millions of dollars to demo. However, it's not in an unsafe situation. I understand the new rec center, they're gonna use that. Then there's gonna be this available center. Instead of spending all those millions of dollars to demo it, maybe the seniors could relocate to that old rec center. And I don't know if that's part of the area plan. It seems like it would be kind of a general, huge deal for the community of South Lake Tahoe and the seniors in that area. So I thought I'm sorry if I'm speaking out of line on paralleling the conversation on the area plan, but I thought I'd make a mention. If I need to mention that at a different time, I can.
And thank you for your feedback on that, that the use of that building, once the new multi-generational center opens, is not, in our area plan. That's not part of the conversation. There would need to be funding to support an additional site, once our services are moved to the multi-generational center. And I believe that is partially discussed in this update as a step that we're taking going forward, and that's been part of our conversations for a while. I can say it's information that we can all take into consideration. I know there is interest in using that site. We do not have funding for that site. We are closing some other sites that we operate and other programs because of the budget deficit that the county's experiencing this year. So, but that conversation would need to be taking place at a higher level.
And with the board of supervisors, higher level, or what higher level?
Our assistant directors in conversations, county supervisors, I don't have authority over that site
Okay.
specifically.
I have a question. Are you speaking about the current senior center or another facility?
Speaking about the rec center in particular, so the new,
Oh, that's
the-
not even our site at all.
And so that, I know that's the city, but then there's the old rec center that's gonna be empty. And then, so I realize that there's the senior center
Yeah,
that county funds support. And I'm wondering if those county funds could just be transferred from the existing senior center to potentially the old rec center, could potentially be the new senior center.
I
know it's
see
kinda
what you're
complicated.
saying. I thought, I misunderstood that. I thought we were talking about the senior center, the recreation center that's been used by the city. I can't even speak to that city
Okay.
operations of that site. I think they have plans for it, so I think that conversation, we couldn't provide any impact on at this meeting.
Okay.
That's not on the agenda.
It's not on the agenda, no.
Anybody else have comments?
Yeah, I do.
Okay.
I have a question about the geographic isolation.
Mhm.
How did that, what formula, or how did you guys determine what's rural, what's isolated?
That
Because
is,
I mean, you appropriated it.
the California Department of Aging identifies that geographic isolation, and they define it as rural areas compared to highly urban, densely settled core areas. So we have a lot of rural areas that aren't densely populated within El Dorado County. So the cities most likely would not be included in that number because you'd have more dense population.
Oh. Drive through a populated area to get to where I live, it's isolated. And it's a part of the unincorporated part of the county, which, other than Tahoe and Placerville, the entire county is unincorporated.
Right, we just have the two sites.
No. I wanted to get back to South Lake Tahoe, which is in this proposal.
Yeah.
And in it, they are specifying that when the new multi-generational recreation center is built, that you're planning on moving into that center.
Into the new recreation.
Now, I understood just nutrition was going to move into that center.
Nutrition, we have staff currently occupied full-time at the senior center
Right.
here, and so they will be moving to that site, but we're still gonna offer the same additional services that we always have offered.
You mean,
Just changing location.
you mean the entire center or just the nutrition? Because our understanding and agreement with the county and the city was that the seniors would retain that building for their use.
I can't speak specifically to that, but the current lease agreement for that site says that the county can have first option for use of that site. The county doesn't have the funding to maintain two sites, two additional sites.
In other words, they're gonna throw us out of our current building.
And I don't know if there's been conversations with the city, we will
They
still have
have had
sites.
lots of conversations and we're not getting straight answers apparently. But this is not what we've been told. Keith, could you enlighten us any?
And I do wanna reiterate, this is the area agency on aging.
Yeah,
Plan, so this speaks to how we're operating our services that are administered through the county.
and
Don, you had a specific question.
Yeah, I'm trying to find out what's moving to the new recreation center and what's going, if the seniors are gonna be allowed to stay in their current building.
Again, this is not, so this right now is our public hearing on the area
Plan.
agency plan.
Well, this is
About
part of the plan.
But about services, so I think we can take this up in the public forum later today.
Okay,
We hear you.
okay, but no, it's
but we
in the
have to-
plan, that's why I'm
This is
bringing
a
it up
public
now.
hearing where we have to stay focused on what it is that we're discussing. Because this is to feed into the services that we're providing.
That the county is providing.
Yes.
If I may, I'm trying to look what he's talking about, it is in the plan, I can't find it in the green. But what I
There is
thought
on,
was consistent with what he's saying, that only the nutrition program is moving to the new rec center, and the seniors are staying in the current building. All right, okay. But I think it's consistent with what he's saying.
and then,
So, but it hasn't been finalized, that is the direction that the city and the county are trying to work with. It even mentions that they're looking for a program coordinator. That position hasn't been filled yet either, and that would support the scheduling and booking the rooms and whatnot. So, but it hasn't been finalized yet, but it is in fact.
and I'll provide more information about the program coordinator, position as well in recruitment when we get to the area, the AAA director update. So I will provide more information on that. But I can speak to county services that are funded, through the Older Americans Act and that are included as part of this. We will continue collaborating. I mean, we're not going to not work with Seniors Inc. because they're an important part of
Right.
services in the community.
So when you say the senior services, you mean like the HHIS and all of that?
The Health and Human
Yeah, right.
Services Agency, our
That-
senior services program.
You're planning to move to the recreation
Mhm.
center? Okay, I'm just trying to
Oh, not
get,
the
because we're not
recre- yeah, the
getting, we're not getting,
multi-generational.
yeah, we're not getting clear information.
We're moving into the new multi-generational
Okay,
center.
thank you.
I just need to reiterate that this discussion has been going on for as long as I've been on the commission, which is almost 10 years now. It isn't over.
Okay.
These things are still negotiable, they're still discussable, they're still budget driven. But there is no final decision. There is no final answer yet. I don't think there will be one in our next year or so. But we are heard, you are heard, and we do have influence in that when the time becomes appropriate. We've made our interests known repeatedly to both the city and the county. We won't stop doing that, but at this point in time, it's the information we have.
Okay, thank you, appreciate that.
It's, Yvette, have you done your area agency, area
Yeah,
services?
If there aren't any more questions,
I
then
don't think
I'm
there's any
done.
answerable question.
I'm sorry, I don't have an answer to some of those questions for you.
So are you gonna do an AAA report?
We have to close, first we have to close the public hearing.
Okay, close, yeah, close public hearing. What's the next, have you done your area agency report?
There's no public, it's just.
I'm a little confused.
No,
You've done the area agency report.
Yes, that's the area agency report. Okay, and closed.
We're finished with open human services. That,
So I will then move on to the area agency on aging directors report.
Okay.
I have a lot of things to update you on. Some of them you've already started asking questions on, so I will elaborate a little bit more to give you updates on what we are in fact working on right now. And, you know, at these meetings, my favorite thing to always talk about is where we're at with staffing and, you know, we've done so much work the last couple of years to really fill a lot of our positions. And we've made some great progress, but you always see staff come and go, and we're looking at a site closure in El Dorado Hills, which impacts, you know, how our staffing levels are maintained. We do currently have continuous recruitment still underway for senior nutrition. So we have Middle site coordinator positions, permanent and extra help. We have positions still available on both slopes. We have a food services aide position, here in South Lake Tahoe that is still underway, and we've been recruiting for our second food service aide up at the site up here. And so these are positions that would move into the new multi-generational center once that opens. We are also recruiting for senior nutrition. We are recruiting a program coordinator, which is mentioned in the area plan update. We just got that approved by the Board of Supervisors. It will be a full-time position up here. We're really excited about it. The position's being looked at to really kind of bring activities together with senior nutrition services in a way that we are boosting the numbers that we're serving in the senior nutrition program. This position will be working closely with Seniors Inc. on site, and will be helping support the scheduling of the rooms. That is a priority for us. We want to make sure everybody has fair use of the space, and you can count on having open, room space for your meetings in there, so that we can ensure we're able to work together to boost services in South Lake Tahoe. We also have a continuous recruitment still underway for our adult day services program. As you're all aware, we are closing our site in El Dorado Hills, and then we are moving the members that are interested in moving, we're moving them up to our Placerville site. And this is part of the funding cuts that have been discussed for our program. So it's a bit of an impact to us. It's sad to see a program go, but we're doing our best to continue to serve the population. We're working with the El Dorado Transit to make sure that we can get a transit route scheduled from El Dorado Hills, picking up members along the way, coming to Placerville on a daily basis. And they've been a great partner in the conversation to make sure that we're able to continue services. We've also shared that they have a program that will also reimburse families if they have to drive their members up themselves. And there's some members that may need a higher level of care and wouldn't be able to ride the transit unsupervised. So that's a bit of an impact. But because they're continuous recruitments, we're able to accept applications at any time. We are currently discussing an offer with a permanent program aide that will be moving to Placerville, and are getting ready to make an offer for an extra help program aide. So I think I'm feeling optimistic that we'll have the staff we need at that site in Placerville when we move members from El Dorado Hills. That move is scheduled to take place at the end of this fiscal year, because we have funding for El Dorado Hills through June 30th, so July 1st, all our members that we serve will have moved up to Placerville. Currently for our adult day services programs, and it's not in a AAA program, it's not funded through the Older Americans Act. It is a fee for service program that has had a high general fund component, which is why we've been in front of the board so many times in the last couple of months talking about our funding. Right now, we've got attendance that ranges similarly at both sites. It's between 7 and 12 for the next couple of weeks. We have about 6 intake and admission appointments scheduled into early June to attempt to bring new members on board. So we are actively underway on getting our numbers up. We are also taking an item to the Board of Supervisors that we've been talking about. This will go to board May 20th. It's scheduled for a time certain at the same time as the senior of the year. So we'll be back to back in those presentations in front of the board. It's a public hearing to discuss and approve the senior daycare fee increase for the resolutions. It should be a fast meeting, we anticipate, because it's been discussed maybe 3 or 4 times in front of the Board of Supervisors already. So those are actions that we're taking with our adult day services program.
Eva, can you mention, so I heard you say, 7 to 12 is really low. That's the daily average. There are more than that, more people being served, but everyone doesn't go every day.
Yeah, so
So we have the numbers for how many?
We have 17 members that are being served overall in El Dorado Hills right now, and then we have I think 21 or 22 that are in Placerville right now. We have a new member that'll be starting next week. But yeah, our members do come 1 to 5 days a week. We see all different schedules, so. And our goals through the end of this fiscal year, we have 2 permanent program aides in Placerville. And so with that, we're looking at getting our numbers up to 16 with the staff that we have. And so that goal is before the end of the fiscal year when we have sites combined and we'll have more staffing available in one site to bump those numbers up further. So right now, we're looking at getting the numbers up to 16 by the end of the year and then bouncing those numbers up as high as we can to meet sustainable goals that will give us the funding that we need to have long-term sustainability in the next fiscal year, so.
But part of that was the staffing issues, and I know you're having trouble having staff. You have such a rotation, but so much of that is, I think, pivotal on the low wages that the county's offering. Has that changed or been discussed at all? I mean,
they're not, the county's not looking at making a big increase to those positions, but on a recent board item, I think the last time we went to board to talk about these programs and budget, the board did approve a new labor agreement. And that gave our staff a 4% immediate increase in wages, and then they'll get another 2% increase at the beginning of July.
and so that applies to
And that's
those lower.
across the board,
Yes.
everybody gets that.
I mean, and the other part of that was just how long it takes to onboard. I mean, I'm a business owner, I know I can get people live scanned and onboarded in about 8 days. And it seems to be, I mean, that's, you know, the FBI, and then I do a secondary background, it just seems like you guys take forever. And that's part of the staffing problem that I observe anyways.
We do, and you know, and we've made some changes to where we are letting staff know, or candidates when they interview, we are telling them upfront what the time frame is. Because that turnaround does vary, it could be anywhere from 2 weeks to 2 months. Sometimes it can take 6 months, if there's something that is in the background, you know, it may take even longer, because then you have to get exemptions approved, and you know, and I don't know what your specific background requirements are for your program.
Pretty much like yours.
And we
go through the state.
Our staff get three sets of fingerprints when they come on board, and the one CDS licensing. And so we might get approval on one side, but then we have to wait for all 3 approvals to come back on background. And we've had things come up, some people don't get clear distinct fingerprints and then they have to go back. Sometimes fingerprints get lost and they have to start all over again. Sometimes they did 2 sets, but they didn't realize they needed a 3 set.
No, onboarding has always been an issue.
It is, yes.
The commission has written a letter in the past, has written a letter to personnel to discuss the fact that it's taking so long and asking the board to approve some expedition.
But there's nothing we can do to expedite.
That's basically
That
the
is-
answer we got.
Yeah, that is, it's.
I mean, those just seem like the 2 roadblocks to
Right.
finding good staff is the low wages and the length, because most of the people you're trying to hire are probably living paycheck to paycheck.
Exactly.
And so they can't hang out for 3 weeks
Right.
even, you know, so they're gonna go over to Harrah's up here, right? I mean, I think that's part of the problem up here is finding staff, is they've got a lot of choices that are paying so much, right?
Yeah.
So it's hard to compete with that.
Yeah, so and that is, it is a huge barrier, but there is a reason for it, you know, and that's part of where I do find comfort. It's unfortunate we struggle, you know, we pull together all the resources we have. We have a really great volunteer pool that we work with. I know Janet comes on site in our Placerville and helps support our program team as well to make sure that we have even additional people that are able to do activities with our members and whatnot. But yeah, we do, because it is, I think we have several positions that meet those base wages that a program aide does, and this is just one of those program areas where it's one of the lowest paid positions in the county, and not everybody is even really aware that the county has caregiver positions that go through regular recruitment. So I think it's part of it is outreach and getting the information out to the community as well. But we are getting a steady group of applicants through right now, and but you know, we do run the risk of losing
Losing
some
them.
of them as they find other employment before we can get them on board. So we do make the disclosure up front. They know what they can anticipate with our hiring process. And again, it can be 2 weeks
Right.
to 2 months on average, I
So
think.
I didn't know that you were able to onboard somebody so quickly. I mean, the impression that I had was it took a lot longer.
Well, it depends on how they come through, but it can take longer. If there's something in the background and there's additional exemptions that have to happen, and then they go on to the medical testing. Sometimes it's the candidate doesn't schedule it quickly, which we need to get it done right now because we know it'll take a while, which is part of why we've been making that pleasure up front.
Can we move on?
Yes, sir, we can move on, but I know this is an important area for a conversation. So some of the progress we've made in the last couple of months, or the last month, I think, since we met last, is we did submit a grant application to Friends of the Seniors for the full $15,000 that's allowed. We're looking at using that to continue to fund assisted transportation, which is part of Jordan's programs, and she'll speak after me. And also to look at some of that funding to help subsidize enrollment fees. We're looking at a rate increase, and so we're gonna try and use some of those funds to not only market for senior daycare interest, but to fund subsidies for daily rates as well as enrollment fees. We are also currently working with the California Department of Aging for new AAA funding for CalFresh Healthy Living and CalFresh Outreach. This will come to us as part of a AAA and doesn't come with match requirements, so it can really help us increase services and offer more services like expanding bingo size, nutritional healthy living courses. So there's a lot of activities we can do with that. So right now, Jordan, Yasmin, and I are in conversations with the state and our fiscal team for the development of a work plan and budget so we can start that in the next federal fiscal year. I also wanted to share that we brought our new meal site coordinator for South Lake Tahoe to this meeting. So we have Jamie, can you pronounce your last name?
Otterstrom.
Otterstrom. So we have Jamie Otterstrom with us. She came to us in March. She is already doing great things up here and building relationships with partners, building relationships with Seniors Inc. And you know, we're looking at ways we can expand services with her help. She's certified as a yoga instructor. She's also a caregiver for a family member that has Alzheimer's. So she also has experience working with the population, you know, with hands-on knowledge of what that can look like on a day-to-day basis and the impact to our families. She has a Bachelor of Science in Environmental Policy and is working on her master's degree in
Integrative nutrition.
Integrative nutrition. So, you know, we met the other day and talked about, you know, using her insight to help us with menu planning for senior nutrition. But we are still serving a full room at lunch service right now. So she's made some positive relationships that are really helping us to grow the program up here. So we're excited to have her on board.
Thank you. Awesome. I'm excited to be here. I am it was Julie Church. Like you, like being a caregiver, you know, you kind of know what's lacking for like the senior community and you want to help, like, it's really, it just touches my heart. But I am excited. I really do want to like build trust with the seniors in the community and let them know that like they're seen by non-seniors. And
yeah. Well, it's good to have you. And then I think my next update, my last update, which I know is part of what everybody's interested to hear and hear right now, is El Dorado County and the city of South Lake Tahoe that have worked collaboratively to establish an MOU that would allow our programs to support the scheduling and increase development of activities at the South Lakes Tahoe Senior Center. So this MOU is only applicable to the current senior center that we're using right now. When it moves to the multi-generational center, a new facility use agreement, memorandum of understanding will be entered into by all parties. The MOU is currently routing for signatures by all parties and is effective upon execution. Along with the MOU, on April 29th, the County Board of Supervisors approved a limited term program coordinator position that we have discussed for South Lake Tahoe. The position will supervise the South Lake Tahoe senior nutrition staff and work in collaboration with Seniors Inc. to increase activities at the senior center. The recruitment for the position is being drafted, so we're working on that right now, and the position has funding through the State Modernization of Older Californians Act through March 31st, 2029. So we anticipate we will have funding for this position through that date. The program coordinator will also assist with the development of a transition plan for senior nutrition and senior programs to the new multi-generational center once it is completed. The City of South Lake Tahoe Parks and Recreation Director John Stark and Health and Human Services Agency leadership will provide additional information regarding senior services at the multi-generational center during our September Commission on Aging meeting that is up here at this site. And at that time, all of the commissioners will be invited to tour the center as long as there are no setbacks to construction that occur before then that may pose a risk for touring.
John?
Yeah.
We have we'll have some.
I had a question on this.
Specifically.
Yeah, but is it possible to get copies of these MOUs that are being circulated?
They will be shared once they are signed, so you will
Do we have to
see-
wait until they're signed to see them?
Yes, you will see those shared.
Well, until they're signed, it's not an MOU,
Okay.
the draft, yeah.
Well, we should see the drafts, know what's going on, I think, but thank you.
And that's all I have. Are there any additional questions? I know Ray is on schedule. Oh wait, Jordan usually will present right after me. So Jordan, you're up.
Good morning, everybody. How are you? I have a few requests. Yasmin, I sent Yasmin up with the fair schedule. I know that people want to maybe edit those fair schedules themselves, but it's just, they have security limits on who can edit. So please, if you'd like to email me, I have some business cards that I sent up with her too. If you see a space in which you'd like to support us and volunteer in our booth, go ahead and send me an email with the times and dates you're available. I will edit that document and put you there. And there'll be more information. Once you do sign up, I will send direct emails to you guys. Once we kind of put the whole plan together with Adult Protective Services, IHSS, where to pick up your tickets and parking and all of that stuff. Assisted transportation, we are currently serving kind of a gap of transportation requests with some ARPA supportive services funding. And until we get that Friends of Seniors funding, which I anticipate would probably be the beginning of July. Our Friends of Family Caregiver Support mini-series, we were up Monday to do our public health emergency preparedness, and it was a great presentation. Unfortunately, we had 5 people. I mean, I say unfortunately, but actually it was a great networking event. We had a community emergency response team of South Lake Tahoe up there, along with our Listos, California. So the representatives of Emergency Response in California that supports the grant for the emergency funds for public health. So we were all in one room learning quite a bit, talking. It's amazing how we all, even as professionals or emergency professionals and response teams, they've learned from each other. So the CERT team was sharing some things with Listos, and then our public health was also joining in those conversations. It was a great presentation. And then we have Monday the 19th. This is our last one, wrapping up multiple mini-series throughout the county. That will be May 19th at 1:30, and senior legal will be presenting. Michelle Ward will be presenting on wills, trusts, and how to prepare yourself as a caregiver with all of those legal documents. Fall prevention, waiting on opening that waiting list, and we are waiting on that contract approval process. I anticipate soon. Senior farmers market. Just want to put that out there. We are looking at a new process, electronic processing with cards. So not too much that needs to be known, except for we're working in a whole new realm, working with the USDA, or I'm sorry, California Department on Federal Food and Agriculture, to kind of learn the process. There are 3 different steps, whereas before we were just literally having them sign a piece of paper and taking them and then providing them paper vouchers. It is now a 3 validation process. So we're going to the WIC site, putting their name in, then we go to another site and activate their cards, and then they're actually signing a paper. So working with the USDA and the California Department on Ag right now, trying to figure out what farmers are also involved. Apparently, I actually just set up a meeting hoping to discuss what farmers in our area have actually signed up for this process. So a little bit more about that. You could look for a press release. Probably, I usually do them around the end of June, distributing in August. So we do come up to South Lake Tahoe. It is one of our bigger turnouts for these vouchers. I think they are $50 vouchers for the senior farmers market for fresh fruits, vegetables, honey, and fresh cut herbs. Year end, just kind of looking at our closeouts for FCSP, assisted transportation, the AAA transport and outreach report, along with our SHEP, Placerville, and the South Lake Tahoe senior health education. Our bingo size is becoming more and more of a hit, just trying to keep it consistent along with our South Lake Tahoe hours. In June, I will be scheduling myself up from 12 to 3 p.m. On Thursdays. After I get through our May mini series, then I will start scheduling for walk-ins and appointments on Thursdays from noon to 3 p.m. at the Senior Center. Any questions? Fantastic.
Thank you, Jordan.
Thank you, Jordan.
And now we can take public comment
Yeah,
on this agenda item.
if anybody has comments to make.
So now it's my turn. Wait, no, this is not open forum. This will only be public comment on anything that Yvette or Jordan just said. Individuals will have 3 minutes to address the commission. And you may only speak once on each individual agenda item. Is there any public comment on what was just said?
Can I discuss, is it okay, being as if we discussed the new position for the program coordinator? Is it proper for me to ask that question?
And we did discuss it, we were.
I have a question about it, so I can.
Okay, just a minute. I have to set the timer, sorry. It's not automatic.
Is it all right?
Go.
Okay. Sorry, we don't know the protocol.
Yeah.
My question is, it keeps talking about this position being part of the nutrition program coordinator, nutrition. Does that mean that when nutrition moves over to the new senior center, that position also transfers over there, or does that stay with the senior center?
The program coordinator stays with our programs, and our programs will move to the multi-generational, so that will be part of the services at the new site.
Okay. Now, do I ask my other questions, or are we totally?
If it relates to
It doesn't, that's the only one that you guys just talked about, okay.
Okay. All right,
I have a question.
one more, okay, go ahead.
Is there a way to disseminate all those wonderful dates to the general public? I mean, can you put it on Tahoe Now, put it in the Trib, so that so the public knows all these wonderful dates without going to the website?
The dates of
all the programs she just talked about.
Can I?
The mini series.
Jordan, you have flyers.
Yes, there are flyers. It's in the Tahoe now. We've done press release. We've also done our Facebook page. We went public health, along with public health. We stopped in at over 16 different places and really did boots on the ground outreach for this last mini series. We are not finding the attendance to be all that great, but we're going to keep pushing. But we put them in the Tahoe Tribune's, I think it's Tahoe Now. I am inboxing, I think his name is Steve, who does a radio show up in South Lake Tahoe to push this information out. So we are, anything that you guys can suggest, I am open to those suggestions on where to find those that these topics would be supporting.
Thank you.
Thank you. I can address another item. Senior Inc. also has a newsletter, and we put in our newsletter that's going out to hundreds of seniors, Jordan's programs.
Thank you.
There's another one behind you.
I just want to address the Tribune never answers their phone. We have not been able to reach them. So her information is a little wrong. Yes.
Oh. No. I was just seeing if she would pass the Kleenex around.
If I can comment about the Tahoe Tribune, I go in and manually request like a classified ad. You have to go to their site and input data on their website for any kind of marketing nonprofit.
Health and Human Services.
That would be me. Hi, I'm Lynette Engelhardt Scott. I'm the Deputy Director for Community Services. I'm happy to be here. Yvette covered a lot of what I was going to mention. I'll just add a few things. So yesterday, the governor released some May revision proposals. We're keeping an eye on that. It was in a conference call, kind of seeing what impact that will have. We'll continue to see how that plays out. That's the governor's proposal. It'll then have to be enacted by committees. There'll be hearings. So we're keeping an eye on that, as well as keeping an eye on what's going on in DC with the federal budget. The House and Senate appropriations committees are working on funding now for fiscal year 26, which starts October 1st. So a lot of our programs, of course, are federally funded that come down through the states. So we're keeping an eye on that. There was some good news for LIHEAP. The federal government, our Home Energy Assistance Program in El Dorado County, we call it HEAP. So that's the help that people get to pay their energy bills. And it includes our weatherization program. The federal government did release the final 10% of the 25 appropriations, which we didn't know if that was going to happen. So we're very happy about that. And that money has come to us. So the state has it. And so we can draw that down, which is very good. We're receiving a lot of applications in HEAP, which is really wonderful. And so our staff continue to process those applications. Yvette mentioned the fee schedule will be at the board on Tuesday. I'll be there. We'll see how that goes. As she mentioned, there's been a lot of conversation about this. If you guys want to see what the 3-year incremental increase would be on that, those are public documents. We can get those out to you as well if you need to see those again. And then I do want to say, so we talk a lot about staffing issues that we have, and it's true and it's real, but I just want to say, I know we've said this here before, we are blessed with wonderful staff. So, we look at the side of recruitment and the struggles with getting new people in, but we are really, really lucky to have a wonderful crew of staff working in senior services as well as elsewhere in the county. So I just want to recognize that. Yes, and I know you know that. But sometimes I think, we focus on the hard side of things and forget to just name the really positive things that we have going for us as well. So we are very blessed to have those. On a very random note, one of the other programs I work with is Animal Services, which is super fun. And we are lucky to have a grant from UC Davis to help low-income people in El Dorado County who can't pay their vet bills. And so I wanted to mention that here. We've been doing a lot of wonderful things with this grant, but we still have funding available. So if you know of somebody, and I think often, seniors living on a fixed income, those vet bills can be really expensive and can be hard. So if you know of someone who could benefit from that, let me know. And we can't reimburse someone for a vet bill, and because of county procurement, they'd have to go through a vet that we have contracts with, or they're a vendor for us, and we can arrange that visit, and then we can cover the cost of it. So, it can be having a dog spayed or neutered, it could be getting dental on an old animal, and in a couple cases already, we had animals that were shot, multiple gun wounds, and we were able to pay for pretty complex surgeries. So it's just it's a wonderful thing that we have from UC Davis, and I keep forgetting to mention it to you guys.
Is there a document that shows qualifications and veterinarians? Is there information available?
I'm kind of the source of that information. I don't know if the vets that we have contracts with, don't quote me.
Yeah.
But off the top of my head, I think we have actual contracts with probably 9 vets throughout the county, but then a number of other veterinarians are vendors, so they're able to receive funding from us, and we've got all their financial information, so we can work with them as well. So there's a lot of vets across the county that we can work with. Yeah.
Income requirement?
The income requirement is, we're not verifying income, but if, someone is telling us they can't afford their vet bill, we'll take them on their word at that.
Have you got a contact phone number?
Yes. You can reach Lynette, because I'm the one that gets to sign off on these. My cell phone's the best way to reach me, and I have a little cheat sheet here, so I don't have to memorize it. 530-957-6214. And it's a 1-year grant. When it's gone, it's gone. We were given $50,000, $40,000 for vet bills, $10,000 to help with housing. If someone has a hard time, containing their animal, we have to seize a lot of animals because they're roaming around, and the owner's unable to keep them contained. So, it's just a wonderful grant. And even though vet bills are super expensive, $40,000 I'm finding goes quite a long ways. Yeah, yep. Anyway, so random, but I did want to point that out to you guys if you're in contact with people who you think we can help with that.
So I have a question for you. So what I'm hearing is that you can't reimburse somebody who just spent a bunch of money.
No.
If they need services, they should contact you.
Yep.
Okay.
Yep.
I'm actually a foster. I foster cats.
Yep.
So.
Yeah, and so it's for people who are unable to take their animal to a veterinarian because they can't afford it.
That's awesome.
Yeah, it's really cool, and it's been lovely working with UC Davis on it. All right, and I think, let me look. I think that's it for me.
Okay. Next we have.
Oh, wait.
Oops.
Now taking public comment.
Oh, that's right.
On the Health and Human Services Agency Management Report. Individuals will have 3 minutes to address the commission, and public comment will be taken from the room. We don't have any public on the Zoom. Is there any public comment?
I had a question.
Is it about this report?
Yeah, I was
Okay.
wondering what the area you service. The area you cover, that you.
El Dorado County.
El Dorado County, okay.
Yep.
Great.
For animal services.
For anything,
Yeah, so I work for El Dorado County.
Okay.
I mentioned Lehigh and Weatherization. We also in Lehigh and Weatherization cover Alpine County. But other than that, our territory is El Dorado County.
Thank you.
Yep. Okay.
Okay, committee reports. And we're looking at executive committee, and I would make that report. And the report is that we executive committee met this month and we created this agenda. And I think we were successful. We got an agenda that's pretty big, but anyway, that's my report. Next is policy and legislation committee, and that's Raylene.
Okay, I'll give you a little bit about the legislation committee, which is CSL. And CSL is the California Senior Legislature.
Yes.
And I'm a senator, and TJ is the assembly member from Dorado County. And so in those roles, we attend meetings and work a lot on getting bills passed that will help seniors. And so we, as you know, have 3 bill proposals that have gone into the bill process. And we are also currently starting to write the proposals we want for next year. And our deadline to get those proposals in is June 1st. And then we will be looking at those in October to determine which one of those proposals will go forward from CSL and sell to the legislature to turn in the bills and hopefully laws.
When you say go forward, what does that entail?
Well, go forward means that after we have these approvals in October, then we have teams that will go out and meet with legislators. And during those meetings with legislators, we present all of the 10 proposals that we have. And then hopefully one of those legislators will say, oh, I like that, and then take it on. And they will then turn it into a bill and then take the regular legislative process, which would take it through the bill process and then on to the governor. And we've had over 200 senior bills from our proposals turning into bills that have been passed.
Wow.
So that's not bad. And this year we have 2 of the 10 are in the process of being proposed bills that have been picked up and are going forward. And one of them, which is the one I've been involved in, is the personal needs allowance for Medi-Cal. And I think I've talked to you about that, and that's the one that gotta do something sometime. $35 is not enough for a person has skills.
That's the allowance that they give to somebody who's on.
In a skilled nursing facility to cover their needs that aren't covered by Medi-Cal.
About 2 candy bars.
And you don't pay for your phone by that, for sure. And we've had that $35 rate since about 1980. Something like that.
That bill has been going up every year.
And so their bill will go up and and this has been presented, we started at like $100, now we're down to $50. We'd like to get it. But we're taking a different approach, Ray, this year.
Oh.
It's not gonna be a bill, it's gonna be put into the budget.
Oh.
And because one of the legislators who's on the budget committee decided he would be willing to take it through the budget process. So maybe we'll get lucky and hide it in there, I don't know. But maybe it's a new approach because the highest needs allowance is Alaska, they get $200.
All right.
Wow.
Yeah.
But now we're 4th from the lowest, just above Arkansas.
Oh, wow.
So there we are. So anyway, this bill will keep going. In fact, it's one of the proposals in anticipation. It doesn't make it. It's a proposal that's going to go forward again this year. So it's in the process of being.
When I was a senator, it was same story.
Yeah. I mean, it's been on, and it's, so that one, at least somebody can sit up but this is the first time, I think, Ray, that it's taken the budget process.
Yeah, that's a good idea.
So that should help hopefully. So anyway, that's what we do. We just had the senior day, rally day, which is a big day put on by the senior legislature. And that involves bringing the public together with legislators. And we have several legislators that made presentations that used to take place at the Capitol, but now it's on Zoom. So
We're open for public comments on this. Everybody has a comment?
Okay.
Okay,
I'll be done then.
moving on. We're at the ad hoc committees. And, Ray, you again,
What?
on the
Outreach.
outreach and education.
Oh, on outreach and education, okay. Well, we are, in the process of still lining up, of outreach and looking for ways to, promote the programs and COA. And, again, we are asking for anybody who would like to help us do that presentations, come up with ideas, connections, and, we're working, to go ahead on that. And we had our last one was Cinco de Mayo in Dorado Hills, and we had 70 people attend, so it's gonna be quite a nice event. So I think we
Very
will
good.
have some things in process. I'll keep it short.
So, okay.
And then the senior of the year, of course, is under that, and I know Liz will take care of that. So I want Liz to talk about senior of the year.
We can stay on agenda, I'll get it.
Okay.
That's later. Okay, next is housing for seniors. That's Jim Mossman.
Do I get public on that?
Oh,
You have-
yes, after we,
No.
After all the ad hocs.
Okay, sorry. You'll speak during open forum.
Okay.
Well, it was in regards to something she had said, so that's why I was wondering.
That would be at the end of all these committee reports, then we'll think.
Yeah,
I write it down.
keep it in mind.
First of all, I'd like to say that there's a list of ad hoc committees. As far as I knew, we were gonna make housing for seniors or senior housing a standing committee. And it's still under ad hoc, because it's not going away. Ad hoc means temporary. It ain't going away. I don't know how many years I've done it now, but it's not going away. And while I talk about that real quick, there's also outreach and education. That's not going anywhere. So why is that under ad hoc? And the membership committee, where's that going? That's not temporary. So I would like to petition to start the process to move those up to committee reports and not list them as ad hoc committees. It gives people the wrong impression that maybe it's gonna go somewhere. I'm not going nowhere.
You don't want it.
Okay.
So
Just throw that out there before I get started.
No, I want to address his point.
Oh, good.
It is under consideration. It was spoken about at the last executive committee.
Okay.
Joan has a plan for it and when she returns to, and I'm sure she will either A, speak to it or give us an aloha when she gets back and address it. But yes, we did talk about it at executive meeting.
Excellent.
And Jim, the policy and the executive committee are in the county ordinance. In order to add these others, we would probably have to go and change the county ordinance to add these committees to the ordinance, which would then trigger a change to the bylaw and the policies and procedures for the
Just
committee.
call it an ad hoc. It's temporary forever. That'll work. It was just a point I wanted to make because I knew about my committee and I saw the other two. Two of my members are not here because Tita is in Alaska and Joan is in Hawaii. So we miss them terribly. Raylene and I are here and we're working hard as always. I'd like to say that the most recent thing in the last month is we have scheduled a meeting, a get together with the Planning Commission. And I'm going to give a presentation to the Planning Commission as to what the Senior Housing Committee of the COA does. And why we would like them to know that and what they can do for us. And if there's anything we can do for them as well. So that's going to come up at their meeting on the 12th of June. I wanted to give you guys the presentation before that, but we just didn't have time. So you guys will see that it's a PowerPoint presentation. You'll see it at our June meeting, which will be a week later than I'm giving it to the Planning Commission. Don't need your vote on it because it's basically, I took our list, the sheet that you guys have seen as to what we do, and I put it in a PowerPoint. Make it palatable to planning commissioners, make it a little easier, they don't have to read, so. I'm gonna see them. Other than that, it's business as usual. We advocate for any senior or affordable housing projects that are going on anywhere in the county. I'd like to say Tahoe is ahead of the county, just like Placerville is. You guys do a good job up here. So I preach to the choir up here, but anybody have any questions about senior housing?
There's affordable housing in Tahoe?
Are you being facetious or you just being?
No.
Is there? Yeah, much more than, we are so far behind. Well, let me add something too. We are so, you all know how far behind we are on what the state says we're supposed to have for affordable housing. We all know that. I mean, it's terrible. And it's times like this when I'm looking at these figures and they're talking about people of low income who are near and dear to my heart, almost 9%, and this is in 3 years. I've always had this vague notion of, yeah, it's increasing, we're getting more seniors. We all know that, but it's kind of blah, blah, blah. When you see it in 3 years, it's gone up 9%. People, this is happening. And then I see that the population greater than 75 has gone up almost 5%. So not only are we getting more seniors over 65, we're living longer. We hear about that. We hear doctors are keeping us alive. This is where you see it. This is the cold hard reality right here. This is what drives me to do what I do on this commission for the last 9 years. And actually before that. This is the kind of stuff that you want to remember and put to memory, because this is why we're all here. Okay? Except for you, I'm not sure what you're doing. Anybody else have any questions? Thank you.
Bishop Committee, Steve.
Yeah, membership committee is looking good. We're full up unless something happened yesterday or this morning.
You can retire.
Can say hello to Penny. Former member of ours and a long friend, so nice to see you. Nice to see you, Alan.
See, it's a committee that can go away. We're full.
But we gotta move along.
Yeah.
Heard the other meeting, we move along. Well, welcome Julie Bauer, of course. Has been introduced 3 times now. Record for us.
Senior of the year, Liz.
Next Tuesday at the Board of Supervisors meeting, time specific at 9 a.m., we have our Senior of the Year, our annual Senior of the Year award. The nominees have come through and we have made a decision. I'm not telling you what it is. You'll have to attend the Board of Supervisors meeting to see who gets the award. And so we are very lucky to be time specific. Thank you to my supervisor, Lori Carlin, for arranging that for us. And then there will be another presentation, I understand, following that. However, we want you all to be invited down to the reception, coordinated by Neil and Janet, downstairs in conference room D afterwards, to give personal comments to all the nominees, not just the designee, but all the nominees need to be recognized for all the service that they have given the county as volunteers over the last year. So we're looking forward to that. It's something that we're very proud of that we do annually. And dear commissioners, comma, we would like you to be there. Thank you, Liz. That is my report.
Okay. Tina Blyden was not here for the tax report, but anybody can report on tax?
No.
She did. Okay, well. Okay, now we're what we call it.
No, Ray. Now we're doing public comment on these ad hoc committee reports.
Yeah, we can do that.
So now taking public comment on the ad hoc committee reports, individuals will have 3 minutes to address the commission. And there is no one on Zoom, so we will be taking it from the room. If there's any comments.
I just have a question. Being new, where does the membership come from? I don't understand that. Who's the membership?
Okay.
I thought you guys did it. Do you have people, other people?
No.
So you are the membership?
Some of us, there's a membership committee, is that true?
Commission.
Yeah, that's what I don't
The commission
understand.
members are, we have 14 members.
Okay,
5 are appointed by Board of Supervisors, one in each district, and Julie is the Board of Supervisors member at large. There are then the following number, the incorporated cities in El Dorado County each have 1 representative. The incorporated city of South Lake Tahoe has John. The incorporated city of Placerville has Steve. That guy with it. The rest are all members, community members, which are appointed by us as the commission. We also have special advocates who have special interests and skills to support our group. Janet is one of those. I think that's it, right? And then we have the incredible support of Yasmin from the county, who does all our messaging and paperwork and keeps us in line.
thank you.
Does that help?
Yes, I didn't understand what that was, so thank
Okay.
you.
Okay, actually what we're doing, let's see. We got an open forum. So I'm still waiting for everybody, I see 3 minutes to comment.
Guess who?
Got one.
And I can talk about anything for 3 minutes, right?
Yeah.
As long as it's not.
Okay.
Yeah, okay.
First of all, I want to say thank you for your generous hiring of Jamie. She has been wonderful at working with Senior Inc. and coordinating. We've never had that type of relationship, so we really appreciate her being there. My next thing is we have a terrible problem with people who come in for legal. We happen to be right next to the legal office. And I give them the telephone number and then I get a call back that says they don't answer their phone. I only had to leave a message. At one point, they were supposed to be there. I was trying to find out if they were coming or not. I got the same recording. I don't know if there's a way to have another number other than the answering service for, like, if we're trying to research what's going on so that we can either tell the person on the phone or tell the person that's standing in front of me what's going on and when the legal is gonna be there. I don't know who to contact in reference to that. The other thing is you talked about your outreach programs. And the thing that I noticed is it appeared to be all in Placerville. Do you do any of that in South Lake Tahoe? And if so, what, when, where?
Jordan was telling you how she puts the stuff out up here.
So it's just those?
No.
Everything she was talking about.
Okay, all right, I misunderstood what outreach was
They were
doing.
specific
Jim,
about.
Yeah,
You're taking some of her time.
okay.
Oh, I'm sorry. We'll give her more time. We're way ahead.
And then my last question, believe it or not, is were there seniors that were proposed for the senior of the year from Tahoe?
No.
Does Tahoe get included in those things at some
Absolutely.
point in time?
We had 3 last year.
Did you?
Well,
Okay.
anyone can nominate.
6 years ago, I was.
You're on my time.
I was answering your question.
That's my last question. Go ahead.
But our senior center can nominate a candidate. And I didn't get chosen, but I attended the board of supervisors and got a certificate and everything, so.
Nice. And when do nominations happen?
Is it this year?
Well, I know, but I mean like next year, when do they?
They open in March,
March, thank you.
end of March, beginning of May.
And it was missed in senior times this year because of some.
The publication had
Yeah.
to change of edit.
So usually it's in the senior times.
And who can nominate someone?
Anyone.
A business, a nonprofit, it can
Yeah.
come from
So
anywhere
you
within
can
the
nominate
county.
someone.
A family, anybody.
I have one question. How many times does the Commission on Aging meet up in South Lake Tahoe in a year? Twice? Okay. So it's really not that big of a deal to have extra
I think
space.
we have it in September.
Okay.
That could
Next year,
be right, yeah.
And it's always, you can always join virtually.
Mhm.
These are public meetings, yeah.
Great, thank you.
And the minutes are recorded and you can get a video of it later if you can't attend now.
So I wanted to address just a couple things at the senior center and it's questions or what I can maybe provide. For the rooms, for scheduling, I was thinking about it, I can put like little plaques up that actually say when your events are. That way everyone understands, like, they don't have to come ask me questions, and I can do that today. And like in the interim for program coordinating, like, for whoever comes into that position and plans it.
Yeah,
But
and
can
I
just
think
put on the doors what's going on.
just to comment a little bit further on your questions, you know, the collaboration and the communication with senior legal. I've been at other sites that senior legal has meetings at, and sometimes I have people that show up because they're confused when their meeting times or whatnot. And we do have contact information. We will work with Jamie as our staff to make sure that that information is being communicated and she knows how to move forward with making those connections.
Thank you. Yeah, that's what I
And
think.
could there be better signage for that? I don't know how it's laid out, but could there be like a big sign with phone numbers and, you know, information so they're not?
This is a public forum now.
That might.
The board will not
Your turn
to
to
talk.
and be like. Okay.
We gotta get back to public forum.
There was one question back here.
Yeah, Penny's got a question. Go ahead, Penny.
No, I just wanna, as far as I know, scheduling goes through the city. Her name is Emily. So if you schedule a meeting, and you schedule a meeting, she should be able to tell you who's scheduled. So that should solve any disagreements.
Keith, did you have your hand up?
Back in the corner. I can answer that. We had a meeting fairly in the last couple of months, and John Stark is actually the one who's supposed to be assisting with the scheduling, not Emily. He accepted that responsibility. I just wanted to offer that, let the commission know that at our last city council meeting, we approved our strategic plan for the next 5 years. And I made sure that seniors were added to it. They've never been added on there before. Everybody's happy. The council was happy that it was finally got on there as one of our plans. It's not specific to anything other than just assist in the development of the seniors in the community. But at least it's in front of the council and it will be addressed going forward, and it'll keep you guys in mind. I know there's been a lot of times where you've been omitted from, different projects as far as verbiage, so I just wanted to, I think it's a very positive move. Thank you, Keith. Great news.
Okay.
Any other?
Yeah. One more comment. I got sidetracked before. I did want to thank everybody for coming up here on this to attend the meeting. Appreciate it. And I too appreciate Jamie, and she, just like a minute ago, she solves problems so well. So, thank you.
I have a comment.
No, you need to comment.
I'm gonna. I wanted to, it's been evident here that people are concerned about what's going on with the multi-generation installation as far as the senior activities, and also what's gonna happen to the other building. We don't know what's gonna happen to the other building. I mean, we can't answer that question. As far as the multi-generational, the Commission on Aging has been involved with that project ever since the beginning. Promises were made, promises are broken, and they're almost always broken. Whether or not there's going to be a satisfactory participation of seniors in that building is up to grabs to some extent. It's apparent to me, at least, that the people who designed and built that building aren't really interested in the seniors. So, but the Commission on Aging is, we have been advocating strenuously from the beginning. Just to let you know, that's what our place is. We're not ignoring that problem. We have a little power. So, in any event, that's what's going on.
I have just a comment.
I'm Carol Louis, I'm president of our local senior Inc. The weatherization is at my house right now.
Oh, cool.
So the county program is alive and well. I had it done about 12, 14 years ago with Project Go. And they found out that a lot of my duct work is not proper, so the duct people will be coming in after weatherization people leave. So it's a wonderful program, and I'm glad that with my low income that I was granted a recipient that. And thank you all. Pass that information on.
There's more other comments, we can close it.
Yeah, open forums closed. Next subject on the agenda is topics for the next meeting. And anybody has anything to add to that? Any suggestions for topics for the next meeting?
Jim, you're gonna bring your PowerPoint?
That's
Okay.
correct. I'll email it to you.
Okay.
Yeah, you'll have it.
All good? Everybody done? Meeting.
Well,
You've been to Tahoe more often. Here or not. Exactly. Yes.